Healthcare professionals have several responsibilities that go with their work, and there are many scenarios where healthcare professionals may not live up to those responsibilities. They may fail to, for example, diagnose a condition. They may fail to treat a condition. They may fail to tell you that you shouldn't drive when you take a particular drug, or combine a particular drug exposure with drinking alcohol. Healthcare professionals may fail to obtain a proper history of mental conditions. There may be a failure to obtain a history of physical conditions, a variety of disorders. There may be a failure to account for allergies, including allergies to medications. There may be a failure to account for what's known as a contraindicated medication, which means that if an individual is taking one medicine, it may be a medicine that has an effect such that the medicine that you're thinking about prescribing shouldn't be prescribed. We also have situations where healthcare professionals are expected to account for what are known as contraindicated comorbidities or conditions. The idea is that if you have a particular disorder, that condition may be one for which you should not be prescribed a particular drug. There's the concept of, or an expectation that a healthcare professional read particular types of records. For example, healthcare professionals today are expected, in the context of prescribing pain medications, to access what are known as prescription drug monitoring program databases that have been instituted by many different states. The idea is to understand whether or not a patient for whom you are considering prescribing a particular medication is already taking a similar sort of medication. There's a record of prescriptions for that particular kind of pain medication. There are expectations of healthcare professionals to read various types of records, and that includes healthcare records or reports from other healthcare professionals. When it comes to whether or not a particular drug should be prescribed and how it should be prescribed, when it should be prescribed, how often it should be taken, or how much should be taken, the physician is expected to understand whether or not a particular individual has a history of liver problems or a history of kidney problems. There's also the concept of properly monitoring a particular patient's condition and drugs. And so the idea is that there can be a failure to monitor the individual simply by communicating with that individual, that patient, or their caregiver. And then there's the other type of monitoring, which has come to be known as drug monitoring, where an individual patient provides a body fluid. It could be blood, it could be urine, and that body fluid is used to analyze for the presence of or the amount of a particular drug in that individual's body fluid. There's also another type of responsibility that healthcare professionals have, and that is to comply with various operating procedures and to abide by certain rules that have to do with how patients are treated when they have a particular condition, the so-called standard of care that physicians and providers need to comply with. There's also the failure to understand the behavioral capabilities, the behavioral aspects of a particular patient. Some patients are more likely to be able to comply with a particular prescription regimen than other patients. And the physician is expected to understand something about that particular patient's underlying compliance capabilities before prescribing a particular kind of medication. Again, there are a variety of different scenarios where healthcare professionals can fail to do that which they are expected to do as healthcare professionals. And if you want to learn more about these types of shortcomings or failures on the part of healthcare professionals, please explore other aspects of the LawMD website.